The Mental Health First Aid Program is part of the Prevention and Early Intervention component of the Mental Health Services Act. The goal of this component is to help counties implement services that promote wellness, foster health, and prevent the suffering that can result from untreated mental illness. The PEI component requires collaboration with consumers and family members in the development of PEI projects and programs. Mental Health First Aid teaches you how to identify, understand, and respond to signs of mental illness and substance use disorders. Adult Mental Health First Aid is an 8-hour training for adults who work with adults. This training gives you the skills you need to reach out and provide initial support to someone who may be developing a mental health or substance use problem and help connect them to the appropriate care. Youth Mental Health First Aid is the 6-hour training that gives adults who work with youth the skills they need to reach out and provide initial support to children and adolescents between ages 6 and 18 who may be developing a mental health or substance use problem and help connect them to the appropriate care. Teen Mental Health First Aid teaches high school students how to identify, understand, and respond to signs of mental illnesses and substance use disorders among their friends and peers. The training gives students the skills to have supportive conversations with their friends and get a responsible and trusted adult to take over as necessary. It is designed to be delivered in schools or community sites in 3 interactive classroom sessions of 90 minutes each, or 6 sessions of 45 minutes each. Schools and organizations offering the training are required to train at least 10% of the adult staff in youth mental health first aid and to train the entire grade level. A critical step in the Teen Mental Health First Aid Action Plan is connecting with a trusted adult. Youth Mental Health First Aid trains adults to be prepared to help young people facing a crisis. The Mental Health First Aid Program serves adults and youth, public safety workers, fire and EMS workers, workplaces, veterans, older adults, rural communities, and higher education. The program also includes a specific teen mental health first aid component designed for high school students beginning in 10th grade. Providing mental health first aid training to individuals within the same community, e.g. schools, families, and adults who work with youth, increases awareness of information, tools, and strategies to prevent and improve mental health issues, reduce stigma, and create opportunities for communication around these issues. The trainings are offered in both English and Spanish. A key success are the 3 trainings facilitated in the community. 3 participants attended the Adult Mental Health First Aid training at Hope Center. 13 probation officers attended the Adult Mental Health First Aid training at the Prevention Training Room, and 7 probation officers attended the Youth Mental Health First Aid training at the Prevention Training Room. Key challenges for this program have partly been due to the COVID-19 issue. Restriction on in-person training slowed training efforts. In order to help address these challenges, instructors can be trained to facilitate online versions of the different mental health first aid modules when the resources are available. The Mental Health First Aid program helps to reduce the stigma of mental health, promote wellness and recovery, reduce the negative consequences of untreated mental illness, including suicide, and inspire others to raise awareness and start important conversations with colleagues, friends, and families about mental health awareness and suicide prevention. The number of trainings to be offered will increase in the next fiscal year. Certain restrictions have been lifted. In-person instruction will help increase the numbers of community members to be served. The number of counselors, educators, school therapists, and the number of youth being served will increase in the next year. The estimate for the next fiscal year is 120 being served.